Hi, I'm Chris. I'm one of the podiatrists at Foundation and also a recreational running coach in some of my spare time. So I was going to talk more today about the risks of developing a running injury. So we know that they're really common, really prevalent. So again, 1 in 2 runners can be injured at any point in time. So in a 12-month period, 1 in 2 runners can get injured. And when you are injured, sometimes those injuries can mean sort of a fairly significant time away from running. So in that space of risk factors, we know that if you're not very experienced, haven't been running for very long, so less than 2 years, that you're more at risk. That if you've had a previous injury, a previous running related injury, that you are more at risk. So a history of an injury definitely will mean more likelihood of getting injured again. But some of the other things that are perhaps more often than not a contributing factor are things like your training and how you're training. So what are called training errors. And this is a really, really complex area. If there was a really simple way of trying to work out how to train so that we're not going to get injured, I can promise you now that that information would be available. That person would be probably a millionaire. So it's very complex. There are different components to training when we're training that can determine, I guess, how much load our body's taking. So it's things like how often we're training or our frequency of training. That can contribute to our total volume of training. So our volume might indicate the total number of kilometres that you're doing per week, or perhaps the total amount of time that you're running for per week. There are things like the intensity of running that you're running at, so whether it's a slow, easy pace versus a faster sort of speed session, versus all the different types of interval trainings that exist for different reasons. And then there's also different things like doing hill running, running on different surfaces, on different terrains. So all of these things can determine, they make up your training and the type of training that you're doing, but it also can determine the risk that you might have for an injury. So there are some things that we know. We know that if it kind of makes sense, like if we do too much too soon, then it can mean that we're more likely to get injured. Our body is not coping well with that increased load and demand, and perhaps there's not enough recovery time between runs. That can mean that our body's got the ability to actually heal and recover. And so that cumulative effect of stress that's occurring each time we go for a run is enough to mean that the tissue is actually not coping and it becomes damaged. So I guess that's the baseline way that we develop musculoskeletal injuries, particularly with running. So what we know is that with novice runners, so if you're new to running, this means less than 2 years, that if you are training more often than 3 times a week, your injury risk is substantially increased. So the advice is to only run 3 times a week. And if you're running 3 times a week, that still will show you'll get definite improvements with how you're running. So your fitness will improve, your running capacity will improve, but you'll be lowering your risk of getting an injury, which is the end goal, I guess. With running 3 times a week, that's also about how you're doing that. So what's not a good idea is running on consecutive days. So if you run on Tuesday, Wednesday and Thursday, that's still only 3 times a week, but definitely that cumulative effect of stress and not enough recovery in between runs can mean that you're more at risk of an injury. So it's best to have a day off in between. You know, you can do that in many different ways: Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, Tuesday, Thursday, Sunday. Lots of different variety there, but essentially 3 times a week is our magic number that we're aiming for. If you are more experienced and have been running for more than 2 years, and if your history of an injury, if you've not been injured in the last sort of 6 to 12 months, then certainly increasing to more sessions per week is absolutely doable. The longer you have been running for, from a history point of view and an experience point of view, the more frequently you can include running in your schedule. Of course, this means that on those days that you're not running, there's no drama at all in doing other forms of exercise, particularly exercise that's not going to be stressful on your lower body. And so things like swimming, going to the gym, bike riding definitely can be used as really good cross-training strategies to assist you with your running. Some of the other things to consider, so with higher intensity training, so doing speed sessions or faster running, that places much greater stress and strain on your tissues. And if you are not yet accustomed to that, then running at faster speeds can also put you more at risk of injury. So again, I guess the rules are that when we are looking at training and some of the training characteristics, we want to make sure that we're not changing too many things at once. If we can keep, for example, the volume of running fairly consistent and only gradually increase that, so the recommendation is not increasing by any more than 10% every 2 weeks. That's a really good way to gradually build what you're doing while at the same time lowering your risk for injury. So yeah, training and the way that we're training and training areas, it's a massive consideration. You know, we can do lots of things to look more in depth into that on each individual case. But readdressing training is one of the key strategies in helping to prevent an injury and also to help to return you from an injury back to running again.